Welcome, everybody. I'm Benjamin Powell, the Director of the Free Market Institute here at Texas Tech. Thank you all for being here for this important event today. 5 years ago today, we would not have been able to gather together like this. We were in the midst of the lie that was 15 days to flatten the curve, that turned into months and years on end of lockdowns and other command and control regulations limiting our civil and economic freedoms. We've come a long way since then. So far, in fact, that we actually changed our plans a little bit for today's event that was planned to coincide with the 5-year anniversary of that, because originally I invited both Dr. Kulldorff and Dr. Declaraion to come here and join us for the event, and both graciously accepted. Since then, many of you know, Dr. Declaraion got nominated and now very, very recently confirmed as the new director of the NIH, one of the very organizations that had persecuted him in 2020 and 2021. Despite how far we've come, we still have much to learn from the lessons of what happened during the pandemic. And there's nobody probably that we can learn more from than Dr. Martin Kulldorff. Dr. Martin Kulldorff is an epidemiologist, a biostatistician, and a founding fellow at Hillsdale College's Academy of Science and Freedom. Dr. Kulldorff received his bachelor's degree in mathematical statistics from Sweden and his doctorate in operations research from Cornell University. He has worked at Uppsala University in Sweden, at the National Institute for Health, and at the University of Connecticut, and was a professor at Harvard Medical School from 2003 until 2024, when he was dismissed. His research centers on developing and applying new disease surveillance methods for post-market drug and vaccine safety surveillance, and for the early detection of and monitoring of infectious disease outbreaks. He is a former member of the vaccine safety subgroup at the Center for Disease Control and Prevention. In October of 2020, he, Jay Bhattacharya, and Sunita Gupta co-authored the Great Barrington Declaration, advocating for a pandemic strategy of focused protection of the at-risk population rather than the indiscriminate lockdowns and command and control regulation of everybody's daily activities. This led government and public health officials, including Anthony Fauci, to engage in a public smear campaign aimed at discrediting Dr. Kulldorff and his colleagues. Government officials censored their free speech rights, and Harvard fired Dr. Kulldorff, himself a vaccine expert, for his own refusal to take a COVID vaccine. There were few voices speaking out against the government's massive infringements on our economic and civil freedoms during 2020. Dr. Kulldorff was one of the most prominent and courageous voices that did at that time, and he paid the price for it. We're honored to have you at Texas Tech today. Welcome.
Thank you so much for having me. It's great to be back in Texas. You can hear I have an accent. I was born and raised in Sweden, but my adventure in the US started in Texas. When I was 8 years old, my father did a sabbatical here. We arrived in the middle of October, and I didn't speak a word of English. 2 weeks later, my mother told me to put on this costume to go out with these other kids, and wherever we knocked on the doors, they gave us candy. So I've been in love with this place ever since. Let's see. So I apologize that this title has 2 lines in it. It wasn't really 2 weeks, it was 2 years, maybe 3 or so, and it didn't really flatten the curve much. So, I'm going to talk about my reflections about the COVID pandemic from a perspective of a public health scientist. When I was in Texas, lived here as an 8-year-old, my parents also gave me a cowboy hat and some cowboy boots. I still have those, but they don't fit me anymore, so I'm sorry that I don't have my hat on. They do fit my daughter here, so she likes those now. When the pandemic started early in 2020, the first 2 places where it sort of became an outbreak outside of Wuhan was in northern Italy and Iran. And as an infectious disease epidemiologist, it was obvious to me then that this virus would spread to every part of the world sooner or later. There was no way to stop there, just like we can't stop influenza. So I was scared for about 10 minutes. As every parent, I care more about my children than I care about myself, and I have 3 children. So I quickly looked at the data from Wuhan to see who had died from COVID. Because obviously anybody could get it. But when you looked at who died, it was mostly older people who died. So I did a back of the envelope calculations, and we didn't know at that time what the absolute risk was, but we could see the relative risk. That there was more than 1,000-fold difference in mortality risk of dying from COVID from the old versus the young. So based on this simple fact that was readily available in February, March of 2020, the response is obvious. We have to protect those at high risk, and we'll let children live their lives, don't interrupt their lives, and young adults should be allowed to do what they normally do, live normal lives, and then eventually we will get through the pandemic in a year or so, and then we can go back completely to normal. But that's not what happened, and that shocked me as a scientist. And when I tried to publish this in the US, I wasn't able to. I guess I was the only professor of medicine at Harvard, maybe, so that wasn't good enough. But I wasn't able to publish in the US. In Sweden, I had no problem publishing in the daily newspapers there, the major newspapers. But then finally in August, I was able to publish CNN, an article about school closures, arguing against them. But not the CNN you think about, CNN Espanol. I know Spanish, I feel okay, if I can't publish something in English, I'll try Spanish. And they published it, but CNN and English did not want the piece. In October 2020, together with Dr. Jay Balacharya at Stanford and Dr. Sunapa Gupta at Oxford, who in my view is the preeminent infectious disease epidemiologist in the world, we had all 3 of us had tried to, as well as many others, were trying to speak up against the nonsense of these lockdowns. But it was very hard to get your voice heard. So we decided to write what we call the Great Barrington Declaration, where we argued for focused protection, better protection of older people in nursing homes, for example, while letting children go to school and young adults to live normal lives. And the reason is we wanted to minimize COVID mortality by protecting the old, but also to minimize the collateral public health damage from the lockdowns on cardiovascular disease, on mental health, cancer treatment and screening, diabetes and so on. And it went viral. It was quickly signed by over 10,000 medical and public health scientists, over 40,000 medical practitioners like physicians and nurses and so on, and 750,000 members of the public, and by now it's almost 1 billion people who have signed this. And what this did was, there was nothing new here, it was just basic principles of public health, but what it did was, it popped the bubble of the established wisdom that there was scientific consensus about lockdowns, and there wasn't. When I talked to my personal colleagues, most people did not think it was a good idea. So basically, they couldn't dismiss us because there were 3 of us. They couldn't dismiss us because we all worked in infectious disease epidemiology. They couldn't dismiss us because we were all from reasonably respectable universities. But they, of course, there were a lot of hit pieces on us. And every time there was a hit piece, there was a yes, good. Because they would link to the Declaration. And people are smart, so if you read a hit piece on it, you click on the link and you read it at 1 page, you say, oh, that makes sense actually. So that's why we got so many signatures. And what we did during the pandemic went against the basic principles of public health. One principle is that public health is not about a single disease, it's about public health in general. So you can't just say, okay, we're going to minimize COVID death. You have to think about cancer, cardiovascular disease, mental health, everything. Of course, you also have to think about education of children. School is important. And you have to think about the economy. The economy is important in itself, but also it's important for long-term health. You have to think about cultural activities. They are important in our lives. And also religious services that serve as that's very important. It serves as the stability of society. So you can't just think, in public health, you can't just focus on one thing. Public health is about the overall health, not just one disease. Also, short-term versus long-term. Some people thought the pandemic is like a hurricane. Okay, hurricane comes, you hunker down for a few days, and then it's over, you can come out and everything is fine. A pandemic is not like that. If it comes, if you hunker down, well, you can actually slow it a little bit, but you're just postponing things for the future. And if you're gonna have a problem, you don't really want to drag it out, because if you're an old person who wants to protect yourself against the pandemic, if you have to do that for several years, that's much harder than doing it for a few months. So we should sort of just save lives short term if that gives the long term much worse outcomes. There was a national experiment, and Sweden went against the crowd and decided not to close down. It didn't, for example, it didn't close schools for daycare for children ages 1 to 15. They all went to school throughout the pandemic. And in the spring of 2020, how many of the 1.8 billion children do you think died from COVID because they went to school? Yes, 0. There were a few hospitalizations, but no death among the children. And we now have the report card, and Sweden, of major Western countries, Sweden had the lowest excess mortality. That's a combination of having low COVID mortality, but also having less collateral damage. Public health is about everyone, and the public health policy must protect the most vulnerable in society, children. I think we are obliged to protect our children and not harm them by closing schools, for example. Low-income families, persons with disabilities, and the elderly. I think the elderly was also thrown under the bus. One of the saddest stories is many old people, they died alone because their family was not allowed to be with them as they were dying in the hospital. And many tragic stories about that. But instead of protecting the older people who were at high risk, we should have focused protection of older people. We did focus protection of young professionals who could work from home, call them the laptop class. Journalists, scientists, lawyers, bankers, and so on. So they didn't need protection, but they were protected, while older people were delivering the pizzas to them, and so on. So that we didn't protect those who should have been protected, but we protected those who didn't need it. And we can see how that affected, this is from Los Angeles, but it's the same in many other cities, that the mortality from COVID was much higher among those areas where there are more poverty, for example. Also in Africa and India, Latin America, they closed down, and again, very tragic. There are people in India, for example, they sell food on the streets, and whatever they make that day, they used to eat. But suddenly that was closed down, so now they had no way to support themselves, so they had to walk for days to their ancestral villages to get back, and some people didn't make it. So it was devastating on many third world countries. Another thing that's important in public health that was ignored is trust, honesty and transparency. public health advice should be evidence-based. It wasn't. They just made things up. 6 feet rules about closing, how close it could be in the schools, masks. They have either zero or minuscule protective effect. And you have to be honest both with what is known, but also if there's something that you don't know, you have to tell we don't know. You have to be honest about that. You can't just make things up. One thing that I think was astonishing as a scientist was the denial of infection-acquired immunity or natural immunity. There were vaccine mandates for people who had already had COVID, even though they had superior natural immunity. And this was some data from 2020, the summer of 2021, where we looked at what's the protection from having immunity from vaccine versus immunity from having had COVID. And if you had the immunity from vaccine, you were 13 times as likely to have a positive COVID test than if you had if you recovered from COVID. So natural immunity is much stronger than vaccine immunity, which is exactly what you expect. It would be very surprising if it was the other way around. For symptomatic disease, it was 27 times more likely from the vaccine. You have 27 times more likely to have COVID, symptomatic COVID, if you had the vaccine versus having recovered from COVID, and 8 times for hospitalization. So infection-acquired immunity is much stronger, as you would expect, than vaccine immunity. That doesn't mean that we shouldn't give the vaccines, because that gives more protection than not having the vaccine if you're old and at high risk. But this idea that somehow there's no natural acquired immunity is very strange. I'm a big fan of the measles vaccine, but I have never taken it myself. The reason, I had measles before the vaccine was available. There's no reason for me to take the measles vaccine. And everybody agrees with that. But suddenly the public health community decided that national immunity didn't exist anymore. But we have known about national immunity for about 2,500 years, which is about the same amount of time that we've known that the Earth is round rather than flat. Thucydides, in his history of the Peloponnesian War, described the Athenian plague in 430 BC, and he wrote, "Yet it was with those who had recovered from the disease that the sick and the dying found most compassion. These knew what it was from experience. They had no fear for themselves. For the same man was never attacked twice, never at least fatally." So for 2,500 years we have known about natural immunity, until 2020, when we didn't know about it anymore for 4 years. And I think now we know about it again, so that's good. Public health requires trust, and it goes both ways. If public health official wants the public to trust them, public health official has to trust the public. And I think the public health official did not trust the public. It instituted mandate after mandate after mandate. And used fear to sway the public. And you should never use fear in public health. You should use facts. So one example, they did a survey in July of 2020. So this was when we had the pandemic for about half a year. And they asked Americans, what proportion of the population do you think have died from COVID already? And in the US, they said 9%. In the UK, they thought it was about 7% that had died. Well, the truth was less than 1% of that, much, much less. So there was a complete wrong perception of the dangers from COVID. COVID was a little bit more dangerous than typically influenza season for older people. But for children, it was actually less dangerous than a typical influenza season. In public health, we shouldn't use coercion. We should use voluntary measures. We shouldn't close playgrounds. We shouldn't have vaccine mandates. And we should not temporarily close the whole world. That's how you get best results, I believe. Also, this is the Free Market Institute, and I think part of free markets is free speech. I think freedom is very important, both for society in general, but also for public health. We have to have a public, open, civilized debate. We shouldn't censor people or slander. This was a few days after we wrote the Great Barrington Declaration. The head of NIH at the time, Francis Collins, wrote to Anthony Fauci, "Hi Tony, see Great Barrington Declaration. This proposal from 3 fringe epidemiologists who met with the secretary, that's Secretary Azar, we met after that with him, seems to be getting a lot of attention, and even a co-signature from a Nobel Prize winner, Mike Levitt at Stanford. There needs to be a quick and devastating published takedown of its premises. I haven't seen anything like that online yet. Is it underway?" So as of Tuesday, Jay Barashaya, one of my colleagues who wrote this declaration, has now replaced Francis Collins as the NIH director. So we now have a fringe epidemiologist leading NIH. This was the answer from Tony. "Francis, I'm blasting in below a piece from Wired that debunks this theory. Best Tony." Apparently he wasn't able to judge it himself, which is not strange because he's a lab scientist, he's not a public health scientist. But his go-to for expertise on this matter was Matt Reynolds at Wired magazine. He's a senior writer at Wired, where he covers climate, food, and biodiversity. So, and I guess he's also an expert on pandemics. He's according to Anthony Fauci. And Dr. Fauci acquainted us with people who denied AIDS. So not very flattering for us, I guess. Or maybe it's flattering to be criticized by Tony Fauci. I don't know which one. When I tried to present my thoughts as a public health scientist, I was also censored by Twitter, LinkedIn, YouTube, TikTok, Facebook. Here was one thing on Twitter that they didn't like. I had a question, Dr. Kulldorff, do you think you younger age group and or people who already have the virus need to be vaccinated? I am not an anti-vaxxer, but I'm vaccine hesitant about this one. It seems to be a religious mantra now that everyone must be vaccinated. So he's basically asking, does natural immunity exist or not? So my response, I think that was logic. Thinking that everyone must be vaccinated is as scientifically flawed as thinking that nobody should. COVID vaccines are important for older, high-risk people and their caretakers. Those with prior natural infection do not need it, no children. I still stand by that, but somebody at Twitter decided that this was misinformation, and this tweet could not be replied to, shared, or liked by anybody else. So I'm a big fan of vaccines. I think they're very important. But and some of you might be, or some of you may not, but let's say you're a really big fan of vaccines. If you are, you should be against these vaccine mandates. Because if I get it, I already had COVID, if I take the vaccine, then that means that there's one less vaccine when there's vaccines in shortage for older people, like my 87-year-old neighbor who hadn't been vaccinated, or people in India or Brazil or wherever. So if there's shorter supply of vaccine, and you take the vaccine when you don't need it, when there's somebody else who do need it, that's actually not good for public health. So if you believe that these vaccines save life in older people, you should have been against the vaccine mandates. there are other reasons to be against vaccine mandates also, about coercion, for example, and freedom of your own body and so on. Here was another thing that was censored. I was actually locked out for about 3.5 weeks from Twitter. I said that naively fool to think that masks would protect them. Some older high-risk people did not socially distance properly, and some died from COVID because of it. Tragic. Public health officials, scientists may always be honest with the public. So if you have masks, they don't work or work really badly. If you then tell people, oh, put on a mask and you'll be safe, then people will go out and about to a crowded setting maybe, and they will be infected. And old people should not be out, during the pandemic, old people should not be out in a crowded setting with or without masks. So they gave false sense of confidence. So I actually think that this message of mask led to more deaths by telling people falsely that they were protected when they were not. You should never do that in public health. I was also censored by LinkedIn, which is owned by Microsoft. I wrote with Jay Declaraion an article, How Fauci Fooled America. LinkedIn didn't like that, or Microsoft didn't like it, so so they censored that when I posted this thing on LinkedIn. Very interesting, though, Microsoft News, they republished it from Newsweek. So they both censored it and republished it. So it was kind of interesting. So when I was banned from TikTok, from Twitter for 3.5 weeks, I was sort of wondering, is it really worth doing it? Should I participate in these things when they are censoring me? I can't say what I need to say. I don't want to censor myself. But I talked to a colleague at Harvard Medical School. She's from her family came from Slovakia, and her father and grandfather was both very active against the communists there. And she sort of told me that, well, there is this censorship, but you have to sort of push it as much as you can, but stay just below, because it is important to speak out. So yes, you do need to censor yourself, but you can still say many good things. So that's what convinced me to say, okay, I will go back and post on Twitter again. So that was very nice to get that lesson from history from my colleague from the Slovakian family. But I tried to be a little bit imaginative also, so I said, okay, I can't talk about masks, but maybe I can write this. Having been censored by Twitter, I must be careful what I write about masks. Well, if you do surgery, if you're a surgeon, please wear a surgical mask. It protects your patients. So, and of course, you wear a surgical mask if you're a surgeon because you don't want your sort of saliva to go into the wound. So it is important for them to wear the mask. So this was my way to get my message across without them being able to censor me. And I think that was the last slide. And I was thinking we could take some questions and answers, but I want to make one more comment first. And that is, when we talk about freedom, freedom of speech, freedom of markets, freedom of entrepreneurship, those are very, very important things. But, and I think one thing we learn from the lockdown is how important it is. That if we take away these things, then health goes down, the economy goes down, the cultural life goes down, religious life goes down. And it is sometimes thought that, well, the people who want these freedoms are the business people and the rich people. But I think that's actually completely wrong. Well, they want it and everybody should have it. But the people who suffer the most if we don't have these freedoms, it's not the wealthy people. It's not Bill Gates, he can say what he wants no matter what. It's actually the common people. Children, low-income families, older people, those who are weakest in society, they are the ones, the poorest in society, they are the ones who need the freedom actually the most. And I think we saw that during the pandemic, that if you were a child and your last name was Newsom and you lived in California, then you went to private school and you could go to private school through the pandemic. But regular kids, they could not. So they had to do home online, and maybe their grandparents had to help them or so on. But they suffered the most from these school closures. So I think that when we talk about freedom and how important it is, we have to realize that freedom is very, very important for the most vulnerable members of society. It's important for everybody, but we should never be thinking that it's only the business people who want the freedom of market and freedom of speech and so on. So thank you very much.
We have a few minutes for questions. I'll ask one to get you started and give them a second. So with Twitter and other news sources censoring you, how much of this do you think it was the business censoring you versus how much was there an effort by people in the government to influence these news sources to not let you speak?
There was definitely attempts by the government to censor and slow things down. And in one of the particular ones for Twitter, there's a direct, I know the direct link. The government funded a group of fact checkers whose job, funded by you guys, the tax dollars, whose job was to find tweets to be censored and then telling Twitter, please censor this. So for one of the tweets, I know there was that direct link. For others, I don't know it, but there was certainly a lot of pressure also on other people, not me, that where the government directly interfered and asked for censoring. For example, Barrington was censored by Twitter, and there are other examples. So there was clearly the government was censoring through the social media companies.
Thank you for your remarks today. Would you speak to the consequences of the vaccine itself? We here in Lubbock lost a very prominent physician recently here in town as a direct result of having taken the COVID vaccine. And those of us who took it or didn't take it, what is the future like for people who took the vaccine, an untested vaccine, by the way?
We don't know. I think that's the honest answer. I think the way that the vaccine trials were done was a scandal. It was very impressive how fast they were developed. So like the Operation Warp Speed for the vaccine, that was very impressive. But when you have a new product, whether it's a vaccine or drug, you want to run double-blind randomized trials to test them out. And for the vaccines, they did a double-blind randomized trials, but the outcome they looked at was symptomatic COVID disease. If somebody had COVID, they had symptoms and they tested positive. I don't want to be heartless, but I don't care if you are home 3 or 4 days in bed because of COVID. What I care about is you not dying. I don't want people to die from COVID, or I also care about hospitalizations. But those are the two things I care about. But the Pfizer, Moderna, and Johnson & Johnson, for their trials, they recruited mostly young and middle-aged adults. And they survived COVID no matter what, whether you have a vaccine or not. So if you wanted to know if this prevented hospitalizations and death, you would have to recruit older people. But they recruited very few older people. So we never knew from the trials whether these actually prevented mortality. There's an excellent vaccine scientist in Denmark, her name is Christine Stable-Ben, she did something brilliant, but what she did, there was, all the trials were not, had a big sample size to find out mortality, but she combined the trials from the mRNA vaccines, and then she combined the trials from the adenovirus vector vaccines, which is J&J and AstraZeneca and Sputnik. And then she looked at all-cause mortality after the vaccine during the few months after vaccination that they were followed. And for the mRNA vaccines, there was no benefit or mortality. Now, this is for young and middle-aged people. There are observational studies that shows that probably there were a benefit for older people in terms of reducing mortality. For the adenovirus vectors vaccine, J&J AstraZeneca, there was a reduction in mortality. So that's the strongest evidence that there was a benefit from the vaccines, at least from the J&J and AstraZeneca vaccines. Now, the other problem is there was no long-term follow-up of the randomized trials because they ended them after a few months. They should have continued to monitor both for efficacy and safety further on, but once they start giving the placebo group the vaccine also, that sort of ends the trial, or the randomized part of the trial. So we don't know, therefore, about the long-term, and when it comes to the boosters, there's not been any proper randomized trials to evaluate boosters. So we don't know as much as we should know about the vaccines.
I might be fine. Dr. Kulldorff, thank you so much for joining us. I'd be curious to know what you think we can do in academia to bring back some of that trust in the scientific method. Do you have a checklist for us, what we can do?
I think that's very important because, now first I would say that the distrust is actually motivated. We deserve the distrust as medical community and public health community. So we should not blame the public for not trusting us because the medical establishment does not deserve the trust, I think, after the pandemic. I think we have to reestablish the integrity by being more open, having open scientific discussions where public can participate, where we, for example, when we have papers, now the peer reviews are secret and anonymous. I think they should be public. If I write a paper, I submit it to a journal, you and everybody else should be able to read not only what I say, but also what the reviewers thought about my paper, if it was good or bad. And we need to be truthful. I think the open scientific debate is very important. And during the pandemic, I was sort of in a strange situation because I was participating in discussions in Sweden where I was pro the government and the state acknowledges what they were doing. I was defending Sweden. In the US, I was criticizing what CDC and FDA and NIH was doing. But there were a group of academics in Sweden who thought Sweden should lock down just like the rest of the world. They were called the Group of 22. There was one infectious disease immunologist, but there were mostly other fields like gynecologists, the mathematicians, and so on. So they wrote op-eds, and I wrote op-eds then countering them, and others did as well. So there was a discussion. And though I really disagree with what they said, very, very much so, I'm actually very glad and grateful and thankful that they actually wrote those op-eds, because that gave me an opportunity to counter what they were saying and argue, no, this is the reason we shouldn't have lockdowns. So they did, by being wrong, but being wrong publicly, they actually did a service to public health and a service to Sweden by allowing everybody to read back and forth. What did Anders Technology think, and what did these people think, and was he able to respond to the criticism, which he was, and I was too, and others was too. So I think that if we need to encourage those who think differently for us to actually express their views and then counter those views in an open debate. I think that's the only way we can have that regain the trust of public health and medicine.
I think we've got time for one more question in the back there, maybe one more up here too.
There was a lot of also censorship here, and I guess everywhere, against effective treatments that were much better than what was being used. Can you understand?
Yeah. So there was one drug that was tested called remdesivir. It was actually approved, but it wasn't very good based on the clinical trials, so it didn't do much good. But there was a lack of, that was a proprietary medication. There was a lack of quick tests of generic medications. Now, there was some discussion about hydrochloroquine, and I don't think that was very effective from the studies that I've seen. Ivermectin, I think, is more, that might have been effective. But there wasn't really any conclusive, strong evidence because there wasn't sufficient studies. But I think that NIH actually failed us there because immediately in this early 2020, they should have immediately started testing all kinds of existing drugs to see if they were effective against COVID in large clinical trials. So I think NIH failed us there, looking at treatment. They were all focused on the vaccines rather than treatments.
Last question, Alex?
Thank you for your talk. I was wondering if you could comment and speak a little bit about what we've learned about pandemic modeling, transmission, contagion. I seem to recall there was a scholar from Imperial College London, I believe, early on in the
Neil
pandemic.
Ferguson.
Yes, who had this very dire model of infection rates and deaths that, unless I'm misremembering, grossly overstated what the actual effects of the pandemic would be. So what do you think that we've learned from the pandemic about the reliability of these models? Have we learned anything about how to make them better? Or is the whole enterprise simply too difficult statistically?
The latter. I think it's useless to try to estimate how many people are going to die and so on. So there was, he and his group made certain assumptions, and then you got those things. And my colleague at the Declaraion said the group that she wrote a paper saying, okay, with this assumption you get this, with this, that, with all these are reasonable assumptions, you can get all these different things. She wasn't allowed to publish that. But she was just trying to show that we don't really know. And I think that, so models can be used to conceptually understand how diseases spread. But to make these models and predictions, I think, is useless. And actually worse than useless, I think it's damaging. What we needed to do more of was to do a basic disease surveillance, like a zero prevalence study, which is to say that you take a random number of people and you say, how many have you already been infected? How many have antibodies already? So you know how many, because in the beginning it was says, oh, but those people who were a case, we know they had COVID, how many died? Well, that was quite high, I think it was like 3% or so. But a lot of people had COVID, we never knew about it. And it's not the case fatality rate as important, it's the infection fatality rate among those infected, how many of those dies. And that was much lower. And CDC should have done that very early, random sample the whole country, different age groups, to find out that, but they didn't do that. They did it like 3 years later, they did one. So it was up to, and my colleague Jay Barrington, he did, I think, the first one in the US for Santa Clara County. He had like a shoestring budget that, okay, at least we do it in the county where Stanford is. And it was very informative. But of course, it was only one county. So those kind of things we have to do during a pandemic to sort of understand it. But those modeling, I think, is useless.
Thank you.
Dr. Kulldorff, thank you so much for joining us today.